When we talk about phalloplasty, we focus a lot on the finish line, but the road there often involves some mechanical setbacks. Today we're breaking down the most common complications from strictures to fistulas, so you know exactly what to look for, and more importantly, how the surgical team fixes them. First up are strictures. This is essentially a narrowing of the urethra caused by scar tissue. You'll notice symptoms like a weakened stream, spraying when you urinate, or feeling like your bladder isn't emptying. Surgeons use various techniques to diagnose strictures, like measuring your stream or putting dye in your bladder. For the treatment of strictures, the gold standard is using a graft, like from the lining of your cheek. This graft rebuilds the part of the urethra that has narrowed. There's also dilation, but that's a temporary fix. Managing these variables starts with being organized. Grab my free Fallo Prep Pack. It includes a master supply list for all 3 stages of phalloplasty, pro tips and logistics, and a mindset and strategy section. You can get that at the link below. Another common complication are fistulas, which are small holes in the urethra. The main symptom of these is urine exiting from anywhere else besides the tip of the phallus. There are a couple ways that your surgeon can diagnose fistulas. The first way is just physical observation of the leak. Another way is placing dye in the bladder and see where the urine is leaking from. The good news, small fistulas often heal on their own. If it doesn't close on its own, the surgeon will usually close it. Sometimes a tissue flap is used to reinforce the area and seal the leak. Navigating these hurdles can often cause panic. That is one of the many reasons why I'm building Deepwater, the phalloplasty recovery system, so you don't hit the panic button when complications arise. We launch next month, so get on the waitlist below to lock in the founding member discount. Beyond the major stuff, there are some minor complications, like wound separation, which is very common above and below the scrotum. This usually just requires diligent wound care and patience as it heals on its own. You also have a slight risk of UTIs because of the catheter use. Prevention here is critical. Drink plenty of water, keep your catheter clean, and follow your surgical team's sanitary instructions to the T. The last complication I'll mention is infection. To prevent infections, follow your surgeon's team's sanitary protocols, and take antibiotics as prescribed. If you notice a change, the golden rule is contact your surgical team immediately. Don't wait and hope it gets better. Early intervention is key to a smooth recovery. If you found this video helpful, please hit the subscribe button below. Stay steady, and I'll see you in the next one.